Now, common factors lead to discontinuation. Side effects, obviously, okay, but guess what? That's not the main reason. I mean, that is one of them, and we'll talk about this, but there's a whole host of other issues. And you better believe it, the vast majority of these are never addressed in a primary care medical setting. Okay, first is money. There simply are people that can't afford certain kinds of medications, even generic medications. Inconvenience. Transportation. There's some people, especially lower socioeconomic status, that don't have a car. They have to ride the bus, or they have to walk in the rain, or something like that. That can be a significant issue. Another form of inconvenience has to do with multiple dosing. People frequently forget to take, 1 out of the 3 doses of medication each day. I mean, probably everybody listening to this program has taken an antibiotic or something, and now and then forgot to take the noontime dose or something like that. It's even worse when we have mood disorders, for reasons we'll talk about in a minute. Complex dosing schedules. This is really a critical issue when a person's taking a bunch of drugs. This is probably seen most frequently in bipolar disorder. And childproof caps. And I'm not kidding about this. People that have depression have very low frustration tolerance. They're feeling horrible about everything. They try to get the top off the bottle, and they can't do it. And damn it, they just throw it away. And that's it. They stop therapy because of something like that. And this, I don't mean at all to be critical or judgmental towards them. It's not shame on you for this. This is depression, okay? And something like that actually can make a difference, okay? Cognitive factors, forgetting to take it, and normal forgetfulness that all of us have from time to time. Obviously, if you have some people that have early Alzheimer's disease or other kinds of dementia, but depression commonly presents with memory problems, as we know. Confusing or complex directions about how to take the medications, like with food. You take this with food and this without food and that sort of thing. Feeling overwhelmed by too much information that's given by the doctor. Everybody, the prescribers feel compelled to share, be very honest with people and share information about side effects and so forth, but sometimes it's just too much to take in. And for depressed people in particular, I would be willing to bet you 95% of them have forgotten 95% of what they were told during the session because, number one, they're depressed and they have memory problems, but number two, when people go in to see a primary care doctor, they're nervous. They may feel some embarrassment about this. They don't remember. Psychological dynamics. Let me mention several here, and these are a big deal. Psychotherapists absolutely need to be involved in addressing. First is consciously or unconsciously wanting to antagonize the prescriber or render them impotent. This has been referred to in the psychodynamic literature as a negative therapeutic reaction. It's almost never conscious. But this oftentimes occurs in people who've been very, very severely traumatized from their kids, and there's this unconscious need to seek out help, but then render the therapist or the physician powerless by saying this medicine doesn't work, that medicine doesn't work. And if this issue is not brought to the surface and addressed in psychotherapy, it's always going to be a stopper. Secondary gain is a big issue for some people. The search for magic, and what I mean here is in highly dependent people, you might see this in people who have severe dependent personality disorder. Some people have borderline personality disorder. That they're looking for the magic pill. They're looking for the good enough mother, the good enough father, and the good enough drug, and they're very likely to get as disappointed with any medication you gave them as they are with many of the people in their life who weren't there for them. Narcissism. This issue, in a sense, has got its own search for magic. They want, guess what, the perfect pill. And when narcissistic people don't get what they want, they get pissed off. And so their irritation can become a major stumbling block, especially in primary care settings. Especially people who have obsessional personalities oftentimes are exquisitely sensitive to particular side effects because, number one, they notice them. Some side effects for the rest of us aren't even on the radar screen. It's no big deal. But they're hyper-vigilant, and they notice things. And also, they tend to oftentimes feel, let's say they get a little bit of sedation, they feel a little bit of loss of control. They may be, on the one hand, desperate to get their depression treated, but on the other hand, it's being undermined by their constantly, feeling a sense of out of control, and then they don't take the medication. And then somaticizers, who typically come in, with a laundry list of somatic complaints. Now they have a laundry list of side effects to bring into their doctors. That's another issue as well. All of these obviously need to be dealt with in psychotherapy. This is a big deal if people have bipolar disorder. These are people oftentimes emotionally healthy up until a point in time where they get, the legs kicked out from under them with a huge first manic episode or what have you. And we all know that the vast majority, maybe up to 90% of bipolar patients, within a few months after they've recovered from their first episode, stop their medicine. They do it for two reasons. One is the side effects obviously are very significant, but the second thing is that people, maybe they were wrong. Maybe I don't have this disorder. And then we go for a number of months and feel like, see, I'm right, I don't have it. And then, guess what? Back in the hospital again. Unexpressed fears. This is very significant, okay? I want to mention to you one patient that came to me in particular, and she'd been in therapy with a psychiatrist friend of mine for it's 1 or 2 years, I don't remember exactly, but she'd taken a number of different medicines. Well, presumably she'd taken a number of medicines. This woman had really severe panic disorder and a lot of anticipatory anxiety between panic attacks. And she came in, she didn't mention this to me until about maybe 3 weeks into therapy, and she looked kind of, ashamed. She wasn't making eye contact, but she said, John, I got to tell you something. The drugs that Dr. So-and-so gave me, I never took any of them. I took the first pill he gave me, but it made me really nervous, and I just was too scared. And I said, well, did you mention any of this to the doctor? Well, no. And she was compliant, was afraid that the doctor, he seemed like a nice guy, might get angry or frustrated or impatient with her or something like that. I mean, that's a profound example, okay? But her fear there was the medication of leaving her feeling more anxious or out of control. A lot of people have heard about the possibility of increased suicidality with antidepressant medications, also possible addictions. Now, this is important here, okay? Some people actually come right out and express their feelings. But many people don't, and that's about being compliant, being intimidated by the doctor and so forth. So this says there are some common misperceptions that many people will understandably be worried about. And what's going on here is the prescriber, rather than waiting to hear about this, is saying, hey, look, I've seen all those ads on TV too for antidepressants. They say it increases suicidality in kids and young people. And what have you heard about that? So actively inquiring about that. And especially parents who have teenagers or even younger children who are being treated, for instance, with SSRIs, stimulants for ADHD. They are worried about addiction issues. Now, one of the most important things I want to say in this whole talk is what I'm going to say right now. Giving information a lot of times does not really do the trick. When people have worries about possible suicide in themselves or their kid or addiction, things like this, they're worried silly. I mean, it's a big deal for them. And so to say, well, the data shows such and such, substance abuse rates actually in ADHD kids that are treated with stimulants are lower than you get in ADHD kids that don't take stimulants. Okay, that may go in one ear and out the other. These people are afraid. And we need to sit down with them and in not a rushed way and have the prescriber say, you know what, a lot of people have fears about taking drugs. And my guess is you do too. When I take medicines, I worry about some of the side effects and that sort of thing. We really need to talk about this. And if it's a fear about possible addiction, there's a time and place to say, well, let me show you a little bit of the research on this. But they need to feel heard or it just isn't going to work. And also, the fact that they need to be heard is just about us being decent to another human being. They have a right to talk about the stuff they're scared about. Stigma continues to be a big deal, okay? And the personal meaning of taking the drug. And again, this is a very big issue. The question is, what does taking this drug say about me? And this may be something they're worried about, what other people are going to think, but also just their own personal feelings and worries about this. And I give lots and lots of talks. And people come up, after the talk and ask questions, and I hear this again and again and again. I'm bipolar. or I know people say, well, I'm diabetic. And I think maybe it's just the semantics here, but I don't think so. They're identifying with the illness. And what I tell people, I say, it's my own opinion, you can take it or leave it, but I don't think you are bipolar. I think that you have bipolar illness. And that can mean a big deal. People feel oftentimes defective. They feel like, oh my God, I've got an incurable disease. This could get transmitted to my kids. All kinds of worries like this. Just taking the medicine, even if it's well tolerated, even if they kind of come to terms with maybe some of the side effects. In the long run, in the research, this has been a critical factor in people eventually discontinuing medicine or taking it at lower doses. So here are 3 factors that always, to at least some degree, go into a person saying, okay, I'll take the medication. First off, they got to say, I'm sick or I have a disorder. And there are many times that people don't do this. Well, people that have dementia, oftentimes they're the last person to really know that they're having severe cognitive problems. People that have schizophrenia, oftentimes there's denial of the illness, or they start developing delusions about being controlled by the prescriber, using drugs to change their mind and that kind of stuff. Many kinds of psychosis. There's a lack of insight, and mania, big time. And people have full-blown manic episodes. There's nothing wrong with me. Yeah, but honey, you're only sleeping 2 hours a night, and you're talking real fast, and you're agitated. Hey, there's nothing wrong with me. Come on, leave me alone. Okay? And we all know about that. Okay? So they got to, at some level, say, you know what the truth is? I've got a problem here. They need to feel motivated to get treatment. And here we get into stuff like, I'm not going to go see some shrink, I'm not going to take any of that dope, I'm not going to go take drug, that can make me drowsy and, impotent and all that kind of stuff. We have to honor the fact that a lot of people value self-reliance. And for them, maybe a part of their life experience is that they have needed to really feel very much in control of their life decisions. And then the stigma. And despite decades of attempts to reduce the stigma associated with mental illnesses, it continues to be a very, very big deal. And finally, and again, maybe this is like stating the obvious, but it's weighing the pros and cons. And this is the efficacy versus the side effects, typically is what that is all about.